Howdy everybody, Dr. Tamara here on Wednesday night Q&A. I hope everybody's doing really, really well. I've got to start by saying I have had an enormous day. It is now 8 p.m. here in Perth and I have been going hammer and tongs since 5 a.m. this morning. So it's really nice to see some faces jumping on. I want to say hi. Thanks so much for jumping on. And I've just put my kids to bed. I'm hoping they don't walk through the door. We've just done some meditation tonight. And it's really good. I don't know if you guys practice meditation and mindfulness, but I find that consistent 10 minutes. I'm not a meditator. I can't spend hours doing it, but I can give myself 10 minutes and I do it with my kids every night. And I just find it's really helpful for just centering and just being present. So yeah, if you guys are meditators and mindfulness practitioners, if you've got any great apps or great tips or tricks to share for the busy, frantic mamas out there, please drop them in the comments. But welcome and thanks so much for jumping on. Righto, now questions. Some good ones coming through tonight. I want to just start once again, like I do every single time we jump on here, and just say that the information that I'm sharing tonight is really generic. It's not pertaining to any one particular individualized scenario. So if you have questions or things that remain unanswered for you here, I strongly suggest if you're currently in care, go and speak to your practitioner, or just go and seek some more answers to the questions that you have that are specific to you, because everyone has their own individualized journey. And really in this game, it's comparing apples and pears from person to person. So don't take one person's journey as being the gospel way to do things. Make sure that you go and seek some more advice. Some really good questions, but I want to start tonight by addressing one question that has come to me in my clinics over the last 2 weeks. Has been posted on Instagram, Facebook, and is really that big elephant in the room, and that's the COVID vaccination around fertility and pregnancy. I am not going to give you my thoughts and answers to that tonight, but I am going to let you know that this coming Saturday, I am going to go live with my thoughts around the COVID vaccine in the context of reproductive health and pregnancy, and the advice that I'm kind of giving to my patients around the very frequently asked questions that I'm getting. All right, so look out for Friday. On Saturday, I'm going to go live. I am very measured in my thoughts about this. It is an incredibly emotionally charged decision that men and women in the fertility space are having to make, not only about their fertility journey, but also about where they sit with regards to the COVID vaccination. And there's a lot of opinions out there. Some of them are educated opinions, some of them are not. But I do appreciate that it's a really emotionally charged space, and I am very measured in my thoughts about this. But so many people are asking, and I think it's unfair of me not to address it. So I'm going to come live on Saturday. I don't know what time yet. It's probably going to be in the afternoon Perth time. I'm going to come live and talk to you about some of the frequently asked questions and answer them around the COVID-19 vaccination in the reproductive healthcare space. So, because that one's been asked a few times tonight. So that brings it down to about 6 really cool questions. So thank you if you have posted some questions, and hopefully you can give me some feedback if you find these answers really valuable. And these are kind of a bit different, bit of fertility, bit of gynae. The first one, let's start with the fertility question. What is the research and evidence around putting 2 embryos back over putting 1 embryo back in terms of pregnancy success rates and implantation success and live birth? Great question. I get asked this so often, and I particularly get asked this in the context of someone who has perhaps had a few single embryo transfers. As many of you may or may not know, in Australia, the Fertility Society of Australia and practitioners here in Australia and also in New Zealand, we have a single embryo transfer policy. That's not the case a lot of places around the world. In some countries and regions, multiple embryo transfer, double embryo transfer is commonly practiced. And there's a lot of different reasons for that. It's not just about pregnancy success rate, but it's also about where fertility funding and so on happens. So we're incredibly lucky, fortunate here in Australia to live where we are, that our fertility services are so well funded and well supported by the governments, and we can afford to encourage single embryo transfers. In fact, around the world, Australia has amongst the best single embryo transfer rates and pregnancy success rates from that in the world. So kudos to all of our fertility colleagues around Australia and New Zealand for that. But I still get asked the question, why not put back to? Wouldn't it be great just to have a double embryo transfer and bang, you've got your family right there, twin pregnancy, awesome. Sounds really romantic, doesn't it? Yay, I've got my family over and done with in one moment. But what we often forget is the much higher pregnancy complications that go with a multiple pregnancy. And as a conscientious fertility practitioner, my job for you is to give you a term healthy baby. That's my job. And by encouraging double embryo transfer and therefore a higher multiple pregnancy rate, we do increase your risks of complications such as preeclampsia, gestational diabetes, preterm birth, cesarean delivery, babies going to the nursery, babies having complications such as infections, complications of preterm birth, and longer term childhood health complications and developmental difficulties. So, it's not without risk, and we have to be really mindful of that when we're talking to our patients about the risks of a double embryo transfer. But here's what the research shows. The research shows us that in an embryo transfer, if you put back 2 embryos versus putting back 1 embryo, in that embryo transfer, you will have a higher pregnancy rate with a double embryo transfer than having a single embryo transfer. But if you put back a single embryo in one transfer, and then if you're not pregnant, you put back another single embryo transfer in a subsequent transfer, so 2 consecutive single embryo transfers, your pregnancy rates are no different than if you put 2 back in the first transfer versus 2 subsequent transfers. I hope that's not too confusing. No difference. But what you don't get is the higher risk of miscarriage from one of those pregnancies taking and one not, then subsequently causing miscarriage of the other, and the complications of a multiple pregnancy. So let me just say that hopefully in a different way if you didn't understand it. If you have 2 single embryo transfers, one, then another one, your pregnancy rate is no different than if you put 2 back in the first one, but you have a lower miscarriage and pregnancy loss rate and lower subsequent multiple pregnancy rate, and therefore complications of multiple pregnancies. So really, it makes a lot more sense to encourage couples to choose a single embryo transfer. Have I put back double embryo transfers? Yes. After multiples of single embryo transfers have been done the first time around. Because there can, in some couples who have been really challenged by their journey, in some couples, to give them that better chance, you weigh it up. But definitely policy, single embryo transfer first and foremost. Hopefully that answered your question. This other question's very cool, I think. At what point in blastocyst or embryo development, so a blastocyst is actually a day 5 embryo, so you get your fertilized egg, your zygote, your day 3 cleavage embryo, a morula, and then day 5 is a blastocyst where there's about 100 cells. So at what point in, I'll say, embryo development does the genetic material of the sperm come into play? That's a really cool question. I had to think about that. And the reality of the question is that the DNA comes into play straight away. You know, once you have half your genetic material coming from mum and half your genetic material coming from dad, and they combine in one entity of 46 chromosomes and all the genetic material of that is an entity from that moment on. The sperm DNA and genetic material matters. What doesn't really matter about the sperm is anything else. So the majority of the inner workings of the early days of those embryos, right up until about day 3, cleavage stage, really comes from the powerhouse of the egg. See, the egg is more than just the DNA. There's the mitochondria, the organelles that produce the energy to make the genetic material coalesce and then to create cell development and division and so on. That comes from the mitochondria and the organelles within the egg. The sperm don't have that. They have the DNA packaged in the head, and then they've got a really important mid-piece, which is the engine that makes the tail move. But as soon as that sperm fertilizes the egg, all of that other stuff just disappears and is ejected, and the DNA, the genetic material, is then absorbed into the two pronuclei, and then the DNA from dad is just as important as the DNA from mum. But there's nothing else about the sperm after fertilization that is useful, but the DNA is incredibly useful right from the get-go. So very cool question. Thanks for asking. Okay, on the news. No, we're not going to talk about the coronavirus tonight. As I said at the beginning of tonight, I'm going to talk about that on Saturday. So I'm going to do a live on Saturday and address some of the frequently asked questions, because there were 2 questions posed here and lots more to me on social media around the coronavirus vaccination. I'm going to talk about that on Saturday. So hopefully you can jump on Saturday and have a listen to my live there. Okay. How do you get your menstrual cycle to return after having a baby who is still breastfeeding? Fabulous question. Evolution is an amazing thing. And evolutionarily, we have been designed such that when we are suckling our young, the hormones that we produce when we have milk production, prolactin, and also the letdown, which is the oxytocin, and all the other associated hormones, also suppress our menstrual cycle. Isn't that amazing? That we have this evolutionary mechanism that whilst we are focused on one of our young and suckling our young, prevents us from having another one. And that kind of makes sense, doesn't it? We're focusing where we should be focusing our attention right now. And so you hear of all of these stories from women about conceiving whilst they were breastfeeding. Some women will get their menstrual cycle back once their load of or frequency of breastfeeding actually reduces. So as you reduce your number of feeds and therefore your total load of breastfeeding, some women's threshold will be such that their ovulatory cycles kick back in. Everybody is slightly different. Some women's menstrual cycles, ovulatory cycles, won't kick in until they've completely stopped. Or one of the most common things that I hear is ceasing the night feeds. So bubs sleeping through the night and their cycles will kick back in. So you can't get your menstrual cycle to kick back in until it's ready to kick back in. And to be perfectly truthful, I actually think that's a really good thing. I think that if you are choosing, and this is a choice thing, if you are choosing to continue to breastfeed your child and your menstrual cycle hasn't kicked in, then be okay with that. And then you choose to decide when and how you wean your child, and then move on to expand your family. I get lots of couples coming to see me who have had a baby through IVF or IUI or ovulation induction, and they come back to see me still breastfeeding, and they'd like to move on to expand on their family, add to their family. They might have frozen embryos in the freezer, and they say, hey, let's go. I'm weaning. Has your menstrual cycle kicked back in? No. Or if it has, it's really irregular. How about we wait? Let's not waste these beautiful embryos. How about we wait until you've completely finished your HPO axis, your hypothalamic pituitary ovarian axis has had the opportunity to start to regulate. It's not being inhibited by any of those other hormones associated with breastfeeding. Let's wait till then. But it's a really great question. Your body will kick back in when it is designed to kick back in. Okay. What is going on when your period disappears? I'm 40 and sometimes I have it every month, and then I might not have it for 4 months. So what this is called is oligoanovulation or oligoamenorrhea, meaning the periods or the ovulation is not happening normally. It's not happening like it is designed to every single month. And there are a whole list of possible causes as to why that might be the case. It might be at 40 that you have started to significantly reduce your ovarian reserve. We're born with a set number of eggs we're ever supposed to have. They're slowly reducing in number as we get older. There's also a quality reduction issue as well, but as we get older, our egg numbers reduce. And there is a point of time when there's about 1,000 eggs left when perimenopause and ultimately menopause kicks in. And what can happen in the perimenopause is there's a degree of ovarian resistance. So the brain is working really hard to turn the ovaries on, but they're not really listening anymore. So the brain's knocking hard, but an egg is not being recruited. And so you need to have blood tests done, and possibly even an egg number test, an ovarian reserve test, and possibly even an ultrasound to figure out if that is the cause. And you'll find that the hormones from the brain are quite high, consistent with perimenopause, because they're trying to turn the ovaries on. So that's one reason. Another reason is some endocrine disorders. So like with high levels of prolactin, either due to things like breastfeeding or even a prolactin producing tumor such as prolactinoma in the pituitary gland. It might be thyroid dysfunction, either overactive hyperthyroidism or even hypothyroidism. So it's important to get that checked out. It could be due to polycystic ovarian syndrome, a late onset of polycystic ovarian syndrome, where hyperinsulinemia or high levels of male hormone androgens impact on the cycle and it becomes really, really, really regular. Obviously, pregnancy is always a cause of maybe having your periods and them stopping again. So they're just some of the reasons, and I think it's really important to go and see a GP who has a special interest in this, or more specifically a gynaecologist or even an endocrinologist who has a special interest, to see what is the cause of any ovulatory disorders that you may have that are showing signs at the age of 40. So hopefully that's really helpful. Is it normal for my period to be irregular after coming off the pill, having been on it for many years, coming off it, and now wanting to fall pregnant? That's a great question. And I often find that... sorry, I've just had a message come through. Thanks, Chloe. I often find that I'm having this discussion with young women who have reservations about starting the pill. Oh, I've heard that if I start the pill and I come off it, my period won't come back. And in truth, in most cases, if you delve deep into somebody's history and ask them about the reason that they went on the pill in the first place, it's often to regulate irregular periods. And so really they're just reverting back to what was going on before they even started the pill in the first place, such as polycystic ovarian syndrome. So I think that it's really important to say it's probably not normal if your period is irregular after coming off the pill. It's probably associated with something that might have been going on either before you started the pill in the first place, or perhaps started to manifest itself whilst on the pill, and the pill itself actually masked that process. That's the majority of cases. There is a small subset of women, however, who will come off the pill having been on it for a while, and the HPO axis does take a little time to kick in, perhaps a couple of months. That, if it is physiological, meaning it's not due to some underlying cause such as hypothalamic suppression or thyroid disorder or PCOS or premature ovarian insufficiency, if it's physiological, it's only going to last a couple of months. If it's 6 months after coming off the back of the pill and you're still amenorrheic, i.e. no periods, that's not normal. That's pathological, and you need to go and look for a cause that's not caused by coming off the pill, off the back of the pill. Cool. So some really good questions there tonight. That was actually it. It's a quiet week this week, but some really, really great questions, some basic physiology in there, which is fantastic. As I said at the beginning, I am going to address the elephant in the room, the big elephant in the room, the COVID-19 vaccine elephant. I'm going to address that on Saturday. I'm very measured because I know that it's a very, very emotionally charged space around the COVID-19 vaccination. Well, it is certainly here in Australia. And so I'm going to have a chat about it, my thoughts on it, my research on it, and some of the frequently asked questions that have been asked around the COVID-19 vaccine, which are fantastic questions. And then I think that you make your own educated choice as to what it is that you do around that space. But have a beautiful rest of your week. Keep the questions coming in. There's so much fun. And it's really good for me to really delve into this space and see if I can put it into understandable language, talk about these areas that I'm really passionate about, and help you empower yourself with knowledge around reproductive health, gynaecology, and fertility. Thank you so much for listening. If you know somebody who you think this information would be really valuable for, please tag them in, please share these videos, or please ask them to come on and join me again next Wednesday night. Have a beautiful week. See you later.